Hi, good evening. Steve Adler. You got a minute? We're going to go over the virus numbers here in our city, talk just a smidge about the voting happening, relatively short tonight. But I do want to begin by saying that I pray that our president and first lady, as with all infected, experience a mild case and a speedy recovery. Let's go ahead and take a look at the first dashboard. This is a infectious disease, and that's important to note. We can do a lot if we all mask and we social distance. But I think that it's instructive that someone even as protected as the president of the United States can catch this virus. And I think that there's kind of warning in that for all of us to be vigilant, to wear our masks, maintain our social distancing, wash your hands. Today, 14 people, new admissions. That's the same number we had yesterday. The 7-day running average is 12. We're doggedly trying to get that number to under 10 and to hold the area under 10. But, we've kind of plateaued out. The University of Texas dashboard has us just under 1 as the R factor, just over 1 as the R factor. And that's the factor that tells us if it's over 1, it's increasing. If it's below 1, then it's not. But anyhow, 14 and then the 12. Number of new cases today, 71. Fairly consistent with our 7-day moving average of 82. That number of cases has been bouncing around also fairly constant during this period of time. You can see the graph in the middle shows relatively flat admissions. We're trying to drive that down and drive down infectivity. Infectivity seems to be dropping. Today, Dr. Escott was previewing for us that the infectivity, both in the general population as well as in the Hispanic population, Latino population, because that's what I key on. Those are our most vulnerable in our community right now. This week only has partial numbers, so they haven't been officially posted, but the partial numbers indicate a drop in infectivity, actually below 4% for the general population, and below 8% for the Latino community. Those are still preliminary numbers, still more tests to come back in, so we'll see if those early indications hold. Janine, let's go ahead to the next dashboard. This is the one that shows us exactly how many people are in hospitals, in our ICUs, and our ventilators here tonight. Numbers in our hospitals, 79. The 7-day moving average, 79. So that's kind of plateaued off. That's what we were looking at. Those are the admissions, tell you how many people came in yesterday. Hospitalized tell you how many people are still in that haven't been released yet. 24 people in our ICUs. That's 2 over our 7-day running average of 22. Ventilators, 13 people on ventilators, 14 is the 7-day running average. So you can see, again, we've kind of plateaued. The number of new cases we had, 71, got added to the total number of cases. We're at 29,647, getting precariously close to a number that, without question, we will pass at some point. In terms of the cases, we're almost to passing 30,000. Number of people that have passed away, the number is 430, and that is one more than yesterday, which means we have one grieving family that are in our thoughts and in our prayers. Those are the numbers for today. I already told you what the University of Texas dashboard showed, that we're also bouncing in and around that one. Some schools are going to start on Monday. Some have already been opened. AISD is going to open on Monday, I think to a 25% level for 2 weeks. We need to be doing everything we can in the community to make the reopening of schools and businesses successful. Mask, social distance. We have to do it even while numbers are low, especially when numbers are low, so as to protect our ability to be able to do things like this. We're going to be watching the schools as they open in that 2-week period of time to see if we have infections that are happening. Thus far, with the schools that are opening, it appears as if we're seeing limited transmission from students to teachers, teachers to students, students to students in the classroom themselves. But there is infection in the schools. We have students that seem to be getting it in extracurricular activities. That would be like, the weight training for athletic teams or cheerleaders or band or orchestra. But it seems like it's being contained within those groups. The other place that we're seeing activity with students really is in parties. It's when kids are getting together in the evening. And I understand the overwhelming sense of need to do that. I was young once too, but that's where we're seeing the activity. But again, both with students in middle school, high school, as well as the students in college, that those clusters seem to be self-contained within that group, not yet spreading to the community generally. But we're going to continue watching that. If you have children that are going to school, urge you to follow the guidance that Austin Public Health has given to schools. Check your children, make sure that they're feeling well. If they're under the weather, please don't let them go to school. Check for fever, check for illness at home before your kids go. And we're hoping that all the parents do that to protect all of the kids and all of the families. Better to stay home if your child's sick or even in doubt. Point out next week the voter registration deadline. It's October 5th. So that's Monday. It's going to be the last day you can register to vote. Voting is just incredibly important. And this year it seems as if most everybody wants to vote. If you want to vote, you have to register first. I'll tell you, I was real disappointed to see yesterday the governor say that each county in Texas can only have one place where people who have mail ballots can go to put your ballot into a box. He said it was a security concern and there should only be one such location. That makes no sense to me. There just is not a security issue. All you're doing is driving up, showing an ID and signing a register and then putting your ballot in a box. One location in the county. Travis County was going to have 4 locations. In fact, we did have 4 locations the day before yesterday. It had already started that way. Announcements and publicity had already started telling people where to go. And once it opens up with an early place for people to drop off their ballots, then to change it seems awfully late for something that's been planned now for a month or two to happen. The people that are dropping off those mail ballots, some of the most vulnerable in our community, and to make it harder or more difficult for those folks to be able to drop off their ballots, if they want to do that and not put it in the mail, to make sure that it gets in a ballot box, we should be letting them do that. But 4 locations for the entire Travis County, 1.3 million people, is not a lot of locations. Now we're down to 1. I look at Houston with several million people. Harris County had 12 locations for a bigger county than ours, and now they're reduced to only 1 location. I would tell you that it's hard for me to look at this and not think that it's happening as a result of trying to make it harder for people to vote. And that's real disheartening. And it's more than that. It seems fundamentally wrong. But assume that this is aimed at you. you still have to vote, no matter how hard it becomes to vote, no matter how long the lines are, no matter if they take early voting days away to diminish the time. Whatever happens, you show up and there's a 6-hour wait in a line. Whatever happens this year, you have to vote. And we have to vote in such great numbers that there's no question of whether or not there was a mistake. We have to vote in great numbers this year, whatever it takes. That begins with making sure that you're registered. Monday is the last day to do that. As a postscript, on Wednesday, I told you the City Council would be meeting yesterday to consider the SAVES resolution to get really targeted funding to childcare, to make sure that that institution, that sector of our infrastructure, social infrastructure, civic infrastructure in our city is able to survive during the pandemic, as well as music venues, to make sure we don't lose them, because if we lose either of those, it's going to be really hard to replace them. The council acted unanimously to focus resources in both of those industries, and I'm just proud to be part of a council that did that, because our focus, as you would want, is to make sure that we take care of, protect public safety, and help ensure that we have the best and quickest economic recovery that includes everybody in our city. With that, we're heading into the weekend. Please be safe, take care of yourselves, avoid large gatherings, still treat this virus as if it is a serious thing, because it is. Y'all take care.